Hello and welcome back to Fun with a Chiropractor. I'm your host today, Dr. Travis Helmers, and today we're going to be talking about inflammation and NSAIDs and their effect on inflammation. So most people know what NSAIDs are. They're things like ibuprofen, Aleve, Advil, and basically their main goal is to help control inflammation or shut off inflammation in the body. However, inflammation is actually a healing process throughout the body. So when we have an injury like an ankle sprain or something like that, the reason why we get inflammation in the spot is because the body is actually bringing blood to the area to help get oxygen and nutrients into those tissues. So let's just talk about what happens real quick. So when I injure a tissue, so if this is a muscle and I pull that apart or strain the muscle, there's going to be actually enzymes released that are going to stimulate inflammation. Within those is going to signal white blood cells. Those white blood cells are going to go off, get other cells called macrophages, and they actually come in and they release metallomatrix proteinases. It's a big word, we'll call them MMPs, to basically chew up all of that inflammation around there. And then as that continually chews up that inflammation, it also lays down new fabrics so that the muscles can go back to a normal. However, when we take an NSAID, such as an ibuprofen in that time frame, it actually shuts those chemicals off that release and actually create that inflammatory response, which is the signals that allow the white blood cells to go and get the other nutrients that come and clean up all that inflammation. So we end up actually getting left with inflammation in that area and resulting in more scar tissue and more problems down the road. So what I've done is I've actually kind of set up a demonstration for what that looks like. And this is going to be simple demonstration. So basically, if I'm at home and Dr. Mindy, who's filming this right now, actually knocks one of my water cups over, I can see that there's water all over the table. I know I need to grab a towel, and I know that I need to wipe that up and clean that up nice and good. And once I get it all cleaned up and dry, which this does not dry as easily as it looks to everyone, once it's nice and dry, we're good to go back to normal. However, the next thing is if I'm on a lot of NSAIDs, I have a lot of NSAIDs within my body, it's basically like putting a blindfold and noise canceling headphones on. And so now, if she knocks over the cup of water, I have no idea that it actually happened, and I just go on without even knowing that it happened, and the mess continues to stay. Now you can about imagine if this was red wine on your carpet, you'd be pretty mad at yourself because that would create a long-lasting stain versus being able to get it cleaned up right away. So one of the things that we highly recommend, instead of taking NSAIDs on that, and again, we can't legally say if you should take or not, but what we recommend is actually going to be what's called Proteomax, and that actually has proteolytic enzymes, which will go in and help the body induce that inflammation and actually eat up those scar tissue that's been building up underneath the surface. If you have any more questions about that, feel free to ask any of your doctors here at Health Source Chiropractic. And remember, have a good rest of your day.